We'll start today's call with comments from Health Commissioner Jan Malcolm and MDH Infectious Disease Director Chris Earsman. We'll then open up for questions from reporters on the line. With that, I'll now turn it over to Commissioner Malcolm.
Thank you, Mike. Good afternoon, everybody. Well, the global and national numbers just continue to rise at a very rapid pace. As of this morning, an additional 487,000 people around the world had been identified with additional cases of COVID-19, bringing that total to over 44 million cases around the globe. And an additional 8,179 people have passed away, bringing the global total to over 1.16 million deaths worldwide. In our country this morning, in the United States, 74,000 additional people were confirmed with COVID yesterday, bringing our total to over 8.7 million cases. Sadly, an additional 989 Americans died, bringing the total now to 226,000 total COVID-related deaths in the U.S. Since yesterday, Minnesota added another 1,916 cases on a testing volume of just under 18,000 tests, bringing our new total of cases to 139,444 cases. Since the beginning of the pandemic, a total of 9,855 people have been hospitalized, with 2,609 of them requiring intensive care. There are 643 people in the hospital now, 37 more people than the prior day. This sets our high watermark for people having been hospitalized during the pandemic, and it's 103 people more in the hospital just in the last week. And sadly, we lost another 19 Minnesotans to COVID-19 deaths, 5 in the metropolitan area and 14 in greater Minnesota communities. I'd like to make a special note. As of a couple of weeks ago, there had been at least 71 outbreaks that we know of associated with weddings around our state. And these 71 outbreaks have involved about 670 primary cases, that being just the cases that were actually at the event, not counting the people that they have since transmitted the virus to and who've gone on to transmit to others, as we've talked about before. But 71 wedding-related outbreaks, 674 primary cases exposed at those events, and sadly, one of our most recently reported deaths was a guest at one of these weddings. This particular celebration took place with an outdoor ceremony and an indoor reception, and we share this information certainly not to shame people. These should be joyous occasions, and we're sad about the heartbreak that I'm sure accompanies this development. So this is not in any way to shame people, but to just alert people that the risk is real, and social settings, such as celebrations and social gatherings of many, many types, are helping to drive this pandemic. These day-to-day numbers, as we've talked about, can be a little numbing. So we're going to try to talk more about overall trends and longer-term trends as we go forward. For instance, the weekly change in our cases is a growth of cases of 10.2% just in the last week. And that's up a full point almost from 9.3% rate of case growth the week prior. This is the first time that the weekly case growth has been this high, over 10%, since the top of our second wave at the end of July. Our 7-day average positivity rate remains at 6.5%, but that is with a 1-week lag factor. And we know that given the number of tests we've seen in the last week, we expect that testing positivity rate to continue to climb. We're now at 21 days of over 1,000 new cases. So sadly, days of 1,000 or 2,000 cases has become our norm. It took us almost 2.5 months at the beginning of the pandemic to reach 13,000 cases, but we've added 13,000 cases just in the last 7 days. This is a pattern that certainly caught the attention and alarmed White House COVID advisor Dr. Deborah Birx when she visited our state last weekend, as we talked about. And these are the patterns that should be alarming to every one of us. And again, we know that so many Minnesotans are doing a lot to help slow the spread of this virus, making personal decisions and family decisions to avoid gatherings, to take personal precautions, to keep our social distance, to not go out when we're sick, and to wear masks. But like I said earlier, when you're fighting a pandemic, a majority isn't enough. We really need everybody to pay attention to these basic prevention strategies and to understand the risk that each of us face and the risk that we pose to our loved ones and our communities if we are transmitting this virus unknowingly. Governor Walz has talked about and kind of used the visual of COVID-19 as a long, dark, cold winter that we have to work our way through, and we are working our way through, and we will. To kind of stick with that analogy for a minute, we'd suggest that these latest numbers show that we're in a strengthening winter storm. And when we're facing a winter storm, we ask people to stay off the roads, not just because their car will be the one to get stuck in the ditch, but because the fewer people we have on the roads, the easier it is for the snowplow drivers and emergency vehicles to keep the roads clear and keep people safe. And we Minnesotans are pretty good at taking winter weather warnings seriously. We understand that the weather is what it is and that we all need to do our part to keep ourselves and others safe. And we'd suggest that we're in that same kind of a situation now with the building COVID-19 storm. We need everybody to do their part, not just for their own good, but for the good of their community and their state. So just as we ask people to stay off the roads during a winter storm, we need people to help us with this COVID storm by keeping social distance, avoiding large gatherings, staying at home when you're sick, getting tested when needed, and by masking up. With that, I'll turn it to Chris.
Thank you, Commissioner. And even as we consider how we can address the COVID storm, we know that the weather promises to be nice this weekend, and Halloween is coming up. And so I just wanted to offer some guidance on Halloween activities as well as safe voting. With both Halloween and Election Day nearly on us, and with the state experiencing an alarming rise in COVID-19 cases, we want to go back and discuss the recommendations that we've offered so everyone is aware as we head into the next few busy days. We know that holidays are important times for having fun and connecting with friends, family, and neighbors, and we know that people will look for ways to celebrate. And the CDC Halloween guidance does a nice job of laying out options for doing that in ways that are lower risk. And as we've mentioned before, the guidance from CDC really breaks things out by risk category. So there's not a do not, it's rather these activities are lower risk, these are moderate, and these would be considered high risk. And the information is quite detailed and can be found on the CDC website, www.cdc.gov. So I'll just give you a few examples, but certainly lower risk Halloween activities include carving or decorating pumpkins with members of your household and displaying them. And I've seen some really great scary COVID pumpkins on Facebook from my friends. Decorating your house or living space is a way to celebrate. Having a virtual Halloween costume contest, having a Halloween movie night with people that you live with, or having a scavenger hunt style trick or treat search within your household or around your home rather than going house to house. Those are all low risk activities. Moderate risk activities would include participating in one-way trick or treating, where you have your treats individually lined up so that people can come and grab their treat without breaking a social distance and without having to interact with the householder. Having a small group outdoor open air costume parade or party where you have people staying 6 feet apart and of course wearing a mask that goes beyond just the creative mask you're wearing for Halloween. And we do want to make sure that a costume mask is not a substitute for a cloth mask. So, even though you may be wearing a mask to hide your identity, consider that you still need to wear a fabric mask. And certainly the high risk activities, these are activities that we really want people to consider avoiding because they put you at much greater risk for spread of COVID. And that would be participating in traditional trick or treat activities where you're handing things out as people go door to door, or even a trunk or treat activity. Definitely attending crowded costume parties held indoors, or going to an indoor haunted house. those are all things that will put you at much higher risk for COVID. So we want to make sure that you can enjoy the holiday and the Halloween festivities, but definitely consider what activities you participate in and what level of risk they are. And I think that the weather warming up means that there are ways to do some of these things safely because it'll be comfortable to be outdoors. We want to emphasize that if you have COVID or you've been exposed to someone with COVID, you should not be participating in any in-person Halloween festivities or should not be distributing candy. And as we've been saying for the last number of days, our message is now more than ever, we need to be vigilant. COVID is in our communities and all around the state. And so getting together with even a relatively small group of people from outside your household is riskier now than it was a month ago. So definitely keep that in mind. So enjoy the holiday, enjoy the weather, but please look for safe ways to do it for your sake and for the good of your community. And then just wanted to mention some things about safe voting. With less than a week to go until Election Day on November 3rd, we wanted to take a few minutes to share some information to help people who may be wondering what they can do to minimize their COVID risk. First of all, we want to encourage everyone to get out and vote so their voices are heard. Second, we know that election officials at the state and local level have been working really hard to make things as safe as possible at voting locations. We thank them for their work up to this point and for all that they'll be doing in the weeks to come. Third, we have extensive safe voting guidance on our website. One tip we can share is that it's a good idea to take steps to avoid crowds if you're voting on Election Day. So certainly vote at off-peak times. Make sure you're staying 6 feet from others. Wear a mask. Wash and sanitize your hands before entering and after leaving the polling place. While in the polling location, you can use alcohol-based hand sanitizer, especially if you are touching surfaces that are frequently touched by multiple people, such as door handles or voting machines. And if you would like more information, we are getting a lot of questions now from individuals as they anticipate Election Day. They may be someone who really, really values that voting in person, but now they may be in quarantine or isolated, and so we're getting some questions about that. And if you go to our website, it will link you to the Secretary of State's site, and there is some information about special situations in which you could ask an agent to pick up and return an absentee ballot for you. So just want to make sure that people are aware of that. And so our safe voting guidance is at health.state.mn.us. And if you go to coronavirus, then you can go to voting, and that will get you to the information that you need, and will also give you a link to the Secretary of State site. So with that, I'll turn it back over to Mike.
Thanks, Chris. Operator, we are ready to take questions.
Thank you. As a reminder, to ask a question, you will need to press *1 on the telephone keypad. And to withdraw your question, press the # key. Your first question comes from the line of Kate Raddatz from WTCO Television. Your line is now open. You may ask your question.
Thank you, Commissioner. I have a question on the topic of testing. You know, we're still hearing from people that it takes them anywhere from maybe 24 hours up to a week to get their COVID test results. Why is there still such a large variance in how quickly people are getting those results? And I guess why aren't we at a point where they are able to get them quicker, more consistently?
Well, thanks for the question. That's Commissioner Malcolm. Yes, there still is variability depending upon what labs are being used. As I think we've shared before, some of our health providers in different parts of the state have contracts with national laboratories, and those national labs have tended to be a bit slower in their turnaround time. But even within Minnesota, some of our in-state labs also experiences fluctuations up and down in turnaround time. One thing we have to note is that with the fall respiratory illness season coming up and influenza starting, there are a large volume of tests, not just COVID tests, going through these same laboratories. So that does put a little bit more pressure on the system. This is all part of why we have been working so hard and will continue to make more types of testing available in more locations, to make it easier for Minnesotans to get tests, and also to do more of the test processing here in the state. But it is a fair point, and we appreciate people's patience, but we also completely agree that it's important to keep on working to make those turnaround times as short as possible. But honestly, 48 to 72 hours is considered to be a pretty good turnaround time.
And you mentioned those saliva testing sites. Is there a goal or timeline of when we may have more, rapid results, or when they do fall within that 24-hour to 48-hour turnaround? Is that something we could see happen where they all are able to do that?
Well, I think that was precisely a big part of the saliva testing strategy and the expansion, the home-based pilot that we're working on with the 23 counties and the Red Lake Nation are piloting that process of being able to take the test from home and send it in and get results back within that 24 to 48-hour window. So that certainly would be one thing. But in addition, I think everybody's interested in these sort of rapid point of care tests or home tests that exist for some other illnesses or conditions that would allow you to get the result right there at home. We don't have those tests available to us yet, but certainly that would be something that also would be great to have in the mix when those become available.
Thank you.
We have the next question comes from the line of Jeremy Olson from the Star Tribune. Your line is now open. You may ask your question.
Hi, I just wanted to ask about some of the Halloween and voting guidelines. I mean, moderate risk is spending 15 minutes with someone at a time. And it also seems like there's not a lot of surface or fomite contact as a transmission risk. So it makes you wonder about all these precautions over Halloween, because a lot of those have to deal with the handing out of candy. Well, if there's not a lot of surface contact, is that really something we need to deal with? Same with just brief interactions at a door. Is all of this really necessary?
Chris, would you take that?
Yep. Thanks, Jeremy. No, you're absolutely right that we're talking about minimal contact. I think that CDC is, in their guidance, is trying to help people recognize that an activity in which you are, going from door to door and exposing yourself to multiple individuals that are not part of your household, and taking things from those individuals. I think they're saying that, the multiple elements of that make that a higher risk activity. So in other words, if you went to one door and left and didn't go to any others, that's one thing. But when you're going door to door to door, that's concerning. And then you're not only going door to door, you're taking things. So I think that's what they're looking at in terms of classifying risk. And they certainly, they don't say, thou shalt not. They're just saying that if you're looking at levels of risk of how you choose to celebrate Halloween, that would be something that they would recommend against.
I just wanted to ask a quick separate question on the hospitalizations, because as the commissioner noted, this is a highest number of hospitalizations we've had, or hospital admissions. When we last had this situation in May, there was a lot of angst coming from the hospitals about capacity and ability to manage. And maybe that's coming, I don't know, but I haven't sensed it yet. Are we in better position to handle the current hospital surge we're facing now compared to last spring?
That's a great question, Jeremy, and something we talk about, literally daily with our hospital and health system partners. There have been, as we've talked about before, some really significant improvements in care as those treating COVID patients have learned and shared knowledge about the best treatment approaches regarding oxygen therapy and the like. The good news is that while our number of hospitalizations has now hit a high watermark, There's still quite a bit fewer people in the ICU than was true at that last wave in July. And I think the hospitals and health systems have gotten better at internally sort of managing their entire capacity as they become more comfortable with COVID as a chronic, complicated illness. They're finding it a bit easier to manage their entire census. And we've talked before about just the extraordinary collaboration that's going on across the system with information being shared daily and folks aware of each other's capacity, and a process that we've set up at the state to help with kind of evening out the load where needed.
Thank you.
Thank you. Next question comes from the line of Hannah Flood from Fox 9. Your line is now open. You may ask your question.
Hi, thank you. As we're 6+ months into this, what information do you guys have about people contracting the virus for a second time? Do you have any numbers on that rate or any kind of window where you think people are most susceptible to getting the virus a second time?
Chris, would you take that?
Sure. Hannah, yeah, this is something that is being looked at across the country in terms of how would we distinguish between a second case of COVID and someone who is continuing to shed virus or remains positive for a very long period of time. So you'll notice that when you hear about this in the news, different countries, some different states who have reported, yes, we've identified an individual who we have confirmed has been infected twice. What they've had to have for that, the criteria that they've used is that they had access to the individual's first sample from COVID and then the second sample, and they're able to do genetic testing and identify that it's a different whole genome sequence that they're seeing, so that they can say, yeah, this really is a different infection. It's not just the same infection lingering, because we know that in some individuals they can have a prolonged period where they will continue to test positive. So it's something that we're aware of and that we're, looking into. And if we hear about situations in which there's a question of that, then we'll reach out to the provider and work to do some more evaluation. But I think it's important to know that CDC has provided guidance to say that if someone tests positive within 90 days of the first time they tested positive, they would not at all consider that to be a repeat situation. So there's a number of things that go into that, but yes, we recognize that unfortunately we aren't seeing lifelong protection from this virus like we do with some other diseases. And so we are looking at that and looking at how we can accurately measure or identify that.
Thank you. And just as a quick follow-up, have you guys been able to confirm, or are you investigating any of these possible second cases in Minnesota?
Yes, we've investigated more than 125 situations where a patient tested positive a second time more than 90 days. But what we don't know is if it's persistent positivity or a new infection. And as I said, the only way to do that is to compare the genetic sequence. And you rarely have access to, the specimens. And so that's really the challenge. We've been able to do it a couple of times, and we've not shown reinfection. And if you look globally, there have been 10 instances where reinfection has been documented. So it's definitely something that's on everyone's radar, but it's not as common, in part because of what's necessary to really accurately identify it. But then again, to say that we have done some testing and have not found it in some of the situations that we've seen.
Thank you.
Thank you. Next question comes from the line of Catherine Richards from Minnesota Public Radio. Your line is now open. You may ask your question.
Hi, Governor Walz was in Moorhead earlier today, where he told a group that the state will be rolling out in the next couple of weeks a massive quick test for 18 to 35-year-olds with results available in 15 minutes. That's hundreds of thousands of people. I'm just hoping to get more detail on that. Like, which test is it? How are you going to do this? Who's going to pay for it? That sort of thing.
This is Commissioner Malcolm. This comes from the conversation that we had with Dr. Birx last Saturday that we talked about, and Dr. Birx mentioned it, I think, in her comments to the press after the meetings, that one of the things that is increasingly being talked about, and one of her strongest recommendations to us, was to try to get a better handle on the amount of asymptomatic or pre-symptomatic spread that is going on, particularly among this age cohort of 18 to 35-year-olds. And that's certainly one of the critical things that has changed during the course of the pandemic, is our awareness of the significant role that asymptomatic or pre-symptomatic spread can play and does play in transmission. So she's just urging that we try some new strategies to get further upstream, if you will, rather than just waiting for trying to manage the consequences of this huge degree of community spread that we have now, that we try to find asymptomatic people and help them understand that indeed they are positive and that they need to quarantine in order to break that chain of transmission. So that's the idea, is in addition to what we're currently doing with all of the community testing, with all of the testing ramp up that we've done across the state, to now take even another step to try to encourage people who may not have any reason to think that they've been exposed, and they're not feeling badly, but they still, just by virtue of what we know about community spread and the possibility that there may be a lot of people, not just there are a lot of people circulating in the community who've been exposed, don't know it, don't know they're positive, and are spreading the virus to others unknowingly. So this is just a strategy to figure out how can we direct some additional testing resources to that group through some of the saliva testing sites that we've set up. I think the idea of the rapid test would certainly make something, doing something of a very broad scale of testing, that would be great. We are piloting the use of some of those rapid tests now to see what we can learn about kind of the best application for that specific rapid turnaround test. And as we've said before, lots of test development is happening in the market, and we look forward to more of those options being available in the future. But we're doing a lot of planning right now on how we could pursue this strategy, and the specifics of which tests might best lend themselves to this.
I'm sorry. So is this the Abbott test that the White House has been talking a lot about? And can you just walk me through what this would look like? Like, would I go to my grocery store and be able to get one of these tests? Although I'm older than 35, so I guess I wouldn't be able to. But just tell me what this would look like for Minnesotans.
Well, that's what we're just in the process of figuring out right now. Like, what would be some of the best ways that we could reach this population, and how might we do some very, very targeted sampling of this population. We're just early in the logistical planning of it, and I think yes, that what Dr. Birx was saying to the governor was, okay, we've got this supply of the Abbott Binox tests. You could use those tests for this sort of broad surveillance purpose. We think it's really important to understand the reliability of the test, and so that's part of why we're doing this pilot right now. That certainly would be great if a large volume of rapid turnaround tests was available and reliable. So we're looking at that right now.
Right, and I just want to be clear. The governor said in 2 weeks, a couple of weeks. I mean, can we expect this to happen in a couple of weeks?
Well, he's made it very clear that he, and we're all feeling a lot of urgency about this. So he wants us to figure out some of these logistics and some of the, the best ways to approach this just as quickly as we can. So we're working hard and working fast. Just the basic idea, though. So even though I can't tell you the specific logistics, I think that the basic idea of trying to, to go beyond what we've been doing before and to just offer even broader testing to try to find these asymptomatic positives is the key thing.
Operator, we have time for one more question.
Thank you. And the next question comes from the line of Paul Scott from Forum News Service. Your line is now open. You may ask your question.
Hi, thanks. Commissioner, President Trump is coming to Rochester Airport on Friday, and I just spoke with the mayor who says she's relayed her wish that with the airport director and area officials that the event should observe the 250-person crowd limit, which is yet to happen at any of these events. And these rallies are, as you know, associated with new cases. Rochester is the home of the Mayo Clinic, so it's a town filled with thousands of essential healthcare workers, as well as people with underlying health conditions. And the state has taken a hands-off approach to these violations so far. Can you explain for us what it is meant to try to run a health messaging campaign that is routinely counteracted like this?
Well, thank you for pointing out just the importance of kind of consistency in the messages and in the actions. That's why the governor has made it clear to all political parties, all campaigns, how important it is to observe the CDC and state guidance on this. We do reach out to event organizers in a number of ways, offer to help them think through how to comply with those limits. We have certainly acknowledged that there's some additional consideration around people's rights to, and interest in participating in the political process. But I think the governor said the other day, really encouraging people to try to, hear what their candidates have to say in another way other than personally showing up to a crowded event. Certainly helps if it's outdoors, but as we've said time and time again, outdoors is safer than indoors, but it's not without risk. And if you're in a packed crowd without masks, being outdoors is no guarantee of safety. So we just continue to try to make it clear to the event organizers what the risk is, and that we are also urging Minnesotans to just take precautions as they make those decisions.
Do we know from contact tracing how many cases have been tied to the president's 4 or 5 rallies in the state by now?
Chris, I don't know if you have any updated data on that.
I don't, but that is definitely something that we can get, but I did not pull that up before today's call.
Great. If you can send that, that'd be great. Thank you.
All right, that is all the time we have for today's call. We invite reporters with any additional questions to reach out to our communications office this afternoon. Have a good day, and we will be back with you again tomorrow.
Thank you, ladies and gentlemen. That concludes today's conference call. Thank you all for participating. You may now disconnect.
You've been listening to State Health Leaders give the latest on COVID-19 in